Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Rivers, Delta State race to vaccinate residents with AstraZeneca and Moderna vaccines in second phase of exercise. World Health Organization trains healthcare workers in Yobe State to care for victims of gender-based violence. And residents across Italy are now required to show documents of eligibility for travel by train, plane and ship. Well, Dr. Tedros Ghebreyesus, Director General of WHO, the World Health Organization, and German Chancellor Angela Merkel have inaugurated the new global WHO hub for pandemic and epidemic intelligence in Berlin. The hub will bring together partners worldwide to collaborate and create the tools and data needed for all countries to prepare, detect and respond to pandemic and epidemic risks. The event also recognized Chancellor Merkel's outstanding leadership in global public health. And the Nigeria Center for Disease Control's Director General, Dr. Chikwe Hekwazu, was also announced as Assistant Director General of Pandemic and Epidemic Intelligence, WHO. Hearty congratulations to him. Let's go over to our first report today, the update of the coronavirus situation as recorded by the Nigeria Centers for Disease Control last night.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours are at 626, amid the spread of the Delta variant in the country. The latest figures were reported from 9 states and the FCT, indicating an increase from the figures reported earlier. Lagos led the chart with 335 infections. 134 cases were recorded in Rivers, 60 cases in Oyo, 41 cases were reported in the FCT, while Osun had 20 cases. 14 cases were registered in Plateau, 9 cases were reported in Ogun. Ekiti had 7, Kwara 6, while Benue registered 1 case. There were 0 cases reported from Kano, Nasarawa and Sokoto State. The overall count of confirmed cases in Nigeria now stands at 192,431. 267 people have been discharged in the last 24 hours, increasing the total number of recoveries to 178,759. 14 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,469. Over 440,000 eligible Nigerians have been vaccinated with the first dose of the Moderna vaccine, while over 20,000 eligible Nigerians vaccinated with the first dose have collected the second dose of the AstraZeneca vaccine. In Africa, there are more than 7.7 million confirmed cases and over 196,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 217 million, while more than 4.5 million deaths have been reported.
The River State Health Authority has reported an uptake in its COVID-19 vaccination drive following the number of persons taking the jab as the third wave of the pandemic rages across the country. State Immunization Officer in Rivers, Joseph Arong, told Channels Television that over 18,000 people have been vaccinated in the past 1 week since the second phase of the rollout began.
Rivers State, which borders at least 5 other states in Nigeria, is currently ranked second in the number of states with the highest infection figures after Lagos, the epicenter of the disease. According to data by the Nigeria Center for Disease Control, the state has a record of 10,467 confirmed cases and 1,280 cases currently on admission. The state appears to be working to flatten the curve as the second phase of vaccination is well underway.
We vaccinated over 18,000 persons up till as at yesterday, and today we're adding the AstraZeneca. Of course, you know we started with Moderna, so we're adding AstraZeneca vaccine, and that is mainly for the second dose of those who have taken the first dose.
Unlike the first phase of the vaccination exercise, health workers say residents seem more eager to take a second jab.
Apart from the efforts that we have made in advertising the vaccine, the disease had been advertising the vaccine by itself. because so many people are coming down with this third wave. People are dying from the disease. And of course, that naturally has made people start coming out for the vaccines. As I'm talking to you, the rush is high.
Despite the effort by the state government, one major challenge against the successful management of the COVID-19 pandemic is a series of misinformation, including one on drug usage. At this sensitization program in Port Harcourt, the state capital, the National Agency for Food and Drug Administration and Control, NAFDAC, is here to educate persons and raise awareness on the use of drugs and personal protective equipment.
One of the major key points is buying your drugs from medicine hawkers. The danger of buying your drugs from medicine hawkers is that most of the drugs are falsified in the first place, they are below standards, and a lot of them are expired. And the danger of using expired drugs is that they have degraded and they have produced very, very toxic byproducts.
According to experts, a positive attitude to getting vaccinated and adhering to non-pharmaceutical preventions would go a long way to contain the outbreak.
Meanwhile, the Delta State government, through the Primary Healthcare Development Agency, has commenced the second phase of the COVID-19 vaccination exercise, where individuals who receive the first jab over 6 to 8 weeks interval and those who are yet to get their first jabs are to present themselves for vaccination. The state government received both the Oxford AstraZeneca and the Moderna vaccine doses to various accredited vaccination health centres across the state. In the meantime, the state government is also working on full actualization of the 2022 budget, with the hope that the economy will come out of the negative impact as a result of the pandemic.
COVID-19 vaccination centers across Delta State are now reopened after the state government received its own consignment of the Oxford AstraZeneca and the Moderna brands of vaccine. At this health center in Oshimili South local government area, residents troop in to register and get vaccinated. Health workers here say over 140 jabs have been administered and they're satisfied with the turnout.
So those people that have taken AstraZeneca, the first dose, they are the ones taking it, the second dose. Then Moderna is for the fresh start. See the same left side, left deltoid muscle of the arm, 0.5 and intramuscularly.
The responses are quite impressive. Yesterday we vaccinated 145 clients, with Moderna and the AstraZeneca. So it's quite okay. The vaccines we have, they are not enough. Just the fact is that it's not enough. So we advise that once you take your first dose, once you get to 4 weeks apart, you should just come back for your second dose so you don't miss it. Because once you give a first dose, we are reserving the second dose for the person. So if you don't come at the exact time you are booked for the second dose, you might miss it.
Some recipients of the vaccines are pleased with the process so far.
I have taken the first one. This is my second jab I just administered to me. And I feel okay.
Residents have been assured of the safety of the vaccine, but authorities say to win this fight, adherence to non-pharmaceutical measures is still necessary.
Katsina State Government has called on residents to take advantage in good faith the availability of the vaccines being supplied to the state, which it says is to complement the efforts of the federal government. Now, the state also received a total of 21,040 doses of the Oxford AstraZeneca vaccines meant for the second phase of vaccination exercise. The state government had earlier received a total of 107,500 doses of the AstraZeneca vaccine in March and a total of 92,370 doses of Moderna vaccine in August, respectively. Well, to talk more about the vaccinations that are ongoing and vaccine mixing, which has been disregarded by the Nigerian government, joining us to talk more about this is Dr. Doyin Odubanjo, a public health physician. Thank you for joining us on the program.
Thank you for having me.
All right. First, I'd like to get, good evening. I'd like to get your thoughts on the appointment of NCDC DG, Dr. Ihikwazu, by the WHO as the Assistant Director General of the Pandemic and Epidemic Intelligence, WHO.
Well, congratulate him. He's joined the doctors migrating out of the country. But on a more serious note, I think it's a testament to how the work in Nigeria is viewed from WHO's point of view, and actually how he also as a person has been viewed and assessed to have performed. So it's a big congratulations, and it's a testament to the quality of personnel we have in Nigeria. Thank you.
All right, we will be talking more about that, especially as they set up the hub. But we've been reminding Nigerians in the last few weeks that the doses of the Oxford AstraZeneca vaccines is meant for those who earlier received the first dose of the same type, the AstraZeneca in this case. Do you think that a lot of people understand it? And how does perhaps vaccination centers or sites monitor this?
Well, I think the AstraZeneca as a first dose present, not right now. But again, you can't take that away, that some people will miss it. It's in much of the information I've seen sent out by WhatsApp by the Lagos State government. But again, I could readily assume that many people would miss that information and they'll still try for a first dose. But that's okay, as long as the centers are organized enough and polite and all that in turning them away to say, no, this is for second dose. And I think they are organized, they have their records. So, and then the person coming to take the vaccination should also be able to show the record of the first dose of the AstraZeneca they got in order to get the second one. So I think that shouldn't be very difficult to do.
So our authorities are saying they've advised no mixing of vaccines, but we know that there are some countries that are mixing. Are there dangers to mixing vaccines?
Well, actually, I don't know of any country mixing the vaccine as a policy. If any mixing happens, it's accidental or incidental, so it's because somebody traveled from one point to another and couldn't get the second dose where he or she was before traveling, and they have another vaccine where you have gone to in another country. Then you might get that, or just an accident in a clinic where they give you a different one. And so far, so good. There are no adverse reports or no reports of adverse effects of mixing. As a matter of fact, the few reports there are suggest that actually it gives you better immune response. However, we must note that those are not studies. So nobody has been doing it intentionally. Therefore, nobody has been able to study it intentionally, as it were, in order to give a guide. But those who have happened to have done it accidentally or incidentally have actually found it to be a positive thing. So we're grateful for that. For so far, so good. So we're glad that it's the case and not adverse reactions.
All right. I'd finally like to get your thoughts. The federal government yesterday says it will consider stricter measures to contain vaccine hesitancy once vaccines are made available to all. What's your take on that?
Well, I don't know who they're talking to. So I think it's about time we talk to experts about our policies. I don't have enough time to dissect that on here today, but I think we really need to talk to experts before we make such policies. I think it's wrong. It's not a policy to put up now, perhaps not even in the future. And there are several reasons why I say that, but I don't have enough time to say that here. And I'll just say that we should tread very cautiously. As a matter of fact, making these statements that we're making contributes to vaccine hesitancy in some people, because they become suspicious and they say to you, why are you forcing me if there's no ulterior motive here? So we need to be careful. We need to talk to all kinds of experts about how to approach these issues in order for us to make evidence-informed policies. We shouldn't just talk because that's how we feel. We should be very careful with what we say.
We appreciate your time always on the program. Thank you so much, Dr. Doyin Odubanjo, public health physician. Thanks for joining us on the program.
Thank you for having me.
When we return, we'll tell you about vaccine hesitancy and how that is growing in the U.S. and other stories. Stay with us. Welcome back. And its quest to provide medical support for survivors of sexual and gender-based violence during the COVID-19 pandemic, the World Health Organization, in partnership with Yobe State government, has undertaken the training of 40 doctors and nurses on clinical management. The emergency manager, WHO Health Emergencies Program, Northeast Nigeria, represented by Dr. Inigbehe Onyiloye, a WHO consultant, reveals that the aim is to increase knowledge and awareness of the healthcare givers on gender-based violence.
Many homes across several states witnessed the rise in cases of gender-based violence during the COVID-19 lockdown. And the World Health Organization is visiting Yobe State to help healthcare workers there build capacity to minimize the number of lives being lost through gender-based violence.
The aim is to increase their knowledge and awareness on gender-based violence, build their capacity on provision of care for survivors, specifically clinical management of rape.
The Yobe State government says it has established 5 additional sexual assault referral centers to mitigate the challenge. The participants are so impressed with the training that they ask for more World Health Organization trainings.
Basically, before this training, my idea about just gender-based violence is centered on female and underage, but after this training I've come to realize that it also applies to the male.
I would like to thank the partners, and most especially the WHO, for this good initiative, and I hope they will give us more support, especially in Yobe State with the rising number of cases we have now.
Some of the lessons learned during this training are that government must improve laws and policies, as well as improve institutional responses so as to curb the menace.
Away from Nigeria, COVID-19 cases are high in parts of the U.S. with low vaccination coverage, especially the Southeast, Midwest and Northwest. In these areas, less than 40% of the people are vaccinated, and there are more than 100 cases for every 100,000 people. Washington correspondent Maria Bird brings us the latest.
The U.S. has a short supply of COVID-19 tests available as schools and offices reopen. Many schools and offices are requiring regular COVID-19 testing for unvaccinated individuals. This shortage may impact the already stretched U.S. medical system that is currently facing over 100,000 hospitalizations. These numbers have not been seen since the height of the pandemic.
This is a pandemic of the unvaccinated. To put it bluntly, because of the Delta variant, hospitals are again fighting the battle that we had hoped would be behind us by now. Unfortunately, we are running out of time as our hospitals run out of beds.
While lawmakers are working to require government employees such as teachers to be vaccinated, many have taken to the streets in protest.
We wore masks, we social distanced, we've done everything that we've been asked. And we worked during an entire pandemic, and we were okay. So now they're switching things up on us, and we're angry.
I am prepared to end this now, and I am officially announcing my exit from the UST.
This is about medical freedom. This is about totalitarianism. This is about... Exactly right. We are headed into a very dangerous area, and if we comply with this, we are setting a terrible precedent for our future.
Southern states like Louisiana and Alabama may continue to see an increase in COVID-19 cases as access to COVID-19 tests and vaccines will be limited due to the catastrophic hurricane that hit the region. From Washington, Maria Bird, Channels Television News.
Joining us for more on the latest happenings in the U.S. is Dr. David Ajibade, CEO, Brain and Body Foundation, also a public health physician. He joins us from Baltimore, Maryland. Thank you for joining us on the program. From our correspondent in Washington, she talked about shortage of COVID-19 testing for the unvaccinated. I mean, that's quite worrying. Tell us about where you are and what the challenges are.
Oh, hi, Innocent. I'm in Baltimore, so it's bad here. It's not as bad as the other parts, like that you mentioned. Everywhere there's the mask mandate and no vaccine passports required yet. But even in the gyms, I was in the gym the other day and we were playing squash, and we came out for a break, and they walked up to us to say, "Well, listen, we have to put our masks on even outside of the squash court." Because the Maryland authorities would come and shut them down if they saw people without their masks. So it's still a problem. The good thing is that there are fewer severe incidences of the COVID-19. So with those who are vaccinated, as you know, they may get it. In fact, they say you may get it. It's easy. It's still the same rate of spread, even if you have a vaccine. But the difference is that it's less severe, and of course, you're highly less likely to die from it. But
we're also seeing. Go ahead. Okay. All right. I was just going to say that we're also seeing some protests in some parts of the U.S. I mean, they talk about medical freedom. And why do you think there's still vaccine hesitancy?
Yeah, I mean, so you watch that and it's like you wonder what is going on. Obviously, there are some basic reasons people don't want to be told to take and put anything in their bodies. They don't want to have that oversight because they feel is the next step to what they call totalitarianism, where the government is watching everything they do. Now, some have legitimate reasons, some have religious reasons. I have someone I met recently this weekend. She was showing me a home, and her son has reacted to vaccines in the past. They require that to take them into the university. He's a freshman, about to start his first year. And even with the letters from virologists and immunologists saying that he cannot take a vaccine, the university was still insisting that he had to take a vaccine. So there are people who have legitimate medical reasons why they shouldn't. Now, obviously, there are others who just don't want to take it, especially the younger age group people who don't want to take the vaccine. But I mean, there are different reasons. The other reason, of course, is that people are afraid of the side effects. Some have been very publicized. Some also feel that there are other drugs that are available, like we've heard about the ivermectin and the hydroxychloroquine. Others feel that there are other things that can be done in this situation. So they're feeling that forcing them to take vaccines and vaccines only, some people find it a little suspicious, and just listening to them talk about it, it makes you wonder. But obviously, vaccines have been extremely successful when it comes to COVID-19.
Finally, Dr. Ajibade, is there a threat of the higher variants than the Delta variants in the public health measures taking place in the U.S.?
Well, absolutely. I mean, we're going to be seeing, we're probably going to go through the Greek alphabet. We're hearing about Lambda now. Who knows? Omega might be around the corner. The bottom line is that it is here to stay. It's going to be an ongoing endemic. It's going to be endemic. The bottom line is that we need to be able to strengthen our immune systems and take whatever is available to help protect us against it. So I think this is an opportunity for us to be more wise about how we take care of our bodies and take care of our health. But it's definitely here to stay.
We'd like to appreciate your time on the program. Dr. David Ajibade is the CEO of Brain and Body Foundation, also a public health physician. Thanks again for joining us.
Thank you.
Japan says that the latest particles found in Moderna COVID-19 vaccines are highly likely to be part of rubber stoppers, but they do not pose a problem to the safety of the vaccine. Japan had suspended the use of 1.63 million doses of Moderna shots last week after being notified of contamination in some of the supplies.
Pharmacists, Japan's Kanagawa prefecture, have found several black particles in a vial of Moderna's COVID-19 vaccine. Authorities have put the rest of the lot on hold. Last week, Japan had suspended the use of 1.63 million doses of Moderna vaccines after being informed of contamination in some of the supplies. Moderna and Spanish pharmaceutical company Rovi have said the cause could be a manufacturing issue and safety or efficacy issues had been identified as a result of the issue. Stricter green pass restrictions have been introduced across Italy, requiring people to show their documents when traveling on trains, planes, ships and intercity coaches. The green pass is a digital or paper certificate that shows if someone has received at least one COVID-19 vaccine dose, has tested negative or recently recovered from the virus. In the Australian state of Victoria, there's been a spike in new locally acquired cases. The state has recorded 120 new local cases of COVID-19 infection against 76 a day before. Victoria was put under lockdown soon after the first case was found early in August. The measures were due to come to an end on Thursday, but the caseload has risen steadily over the last 4 weeks. In neighboring New Zealand, police checkpoints have been installed on roads in Auckland, while the tough lockdown measures enforced to counter the spread of the Delta variant of COVID-19 are eased for the rest of the country. The country reported 75 new cases over the past 24 hours, up from 49 a day earlier. Although 74 were in Auckland, the city will remain in strict level 4 lockdown for another 2 weeks. Residents in Bangkok have returned to shopping malls after they were allowed to reopen, giving a sense of normalcy after nearly 3 months of tough restrictions to curb spiking COVID-19 cases. Saloons, barber shop, food massages and sport fields in 29 high-risk provinces were also allowed to resume operations, while restaurants could reopen to diners following an announcement by a COVID-19 task force on the 27th of August. The relaxation comes as the country battles its worst coronavirus outbreak and struggles to ramp up vaccinations, with only 11% of its more than 66 million population fully inoculated.
COVID-19 spreads easily from person to person. Continue to take responsibility. You can take a look at our website. It has the latest updates on the pandemic, the COVID-19 strategy, which guides the public health response, and you can also find all the breaking stories. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Wonga. Stay healthy.